All right, the first patient for this deliberate practice is Taylor Swift. Date of birth 7/21/1980. She has an allergy to penicillin, and then the Doctor Who ordered 1 nitro tab sublingual now, and then also 1/2 inch of nitro paste to be given now. She's having some chest pain, some angina, and then we have the medications. This will be my nitro paste. And then we have the nitro paste, expiration date's good. And then we also have the nitro tabs, which expiration date is good. So we're gonna take this as the nitro paste, and we're gonna do 1/2 inch on here, and this will be applied to the chest. It's a stuffed animal, so I don't want to apply it, but it will go either here for 12 hours, and then it'll switch to the other side for after 12 hours of it being off. Hi, I'm Taylor. I'm gonna be your nurse today. Are you Taylor Swift? Hi, Taylor. Can you just verify your name and date of birth for me? All right, perfect. All right, so it looks like you were having some chest pain. What's your pain level at? A 10. All right. So I'm gonna give you some medicine. It's gonna take you're gonna have it for the next 15 minutes. Most likely it's 1 tab every 5 minutes for the max of 3 tabs for 15 minutes, and then I'll stay in here with you. Keep an eye on your blood pressure, your heart rate, seeing how you're doing. So this is gonna go underneath your tongue. You're gonna put it underneath, let it dissolve, and then beep. We'll keep it going, okay? All right. Underneath your tongue. All right. And then that Doctor Who also ordered you some nitro paste. This is gonna go on your chest. It's gonna hang out there for a little while. It's just gonna sit there, just so we know what side it's on. My name and the initials are on the tab for it. That's gonna stay on for about 12 hours, and then it's gonna come off. Gonna be off for a little while, and then we're gonna put it on the other side. Documenting on the chart, stating how patient's doing, what her pain level's at, which she stated was a 10, that we gave her it at 8:05 at night, and that we'll give another dose at 5 minutes from now, so 8:10. Check what her pain level's at, and we want her pain level to be a 0. We will also inform patient that a headache may occur, which is a normal reaction. Blood pressure will be taken before she takes the medication when she is at home. She will also want to sit down, take the medication. If the pain doesn't go away, then she'll call EMS to bring her back into the hospital. She's a 30-year-old female, and this could be a response from anxiety, stress, congenital heart failure. Amy Farrah Fowler, date of birth 10/22/1967, allergic to penicillin. She's coming in for fluid retention. Doctor Who ordered some Lasix, 20 milligrams to be taken by mouth daily. The medication we have on hand is furosemide, Lasix, 20 milligrams. Date of birth is good. Hi, my name's Taylor. I'm going to be your nurse today. Amy? Hi, Amy. So it looks like you're having some fluid retention. How you feeling? All right. Doctor Who ordered some Lasix for you. This should help bring down the swelling and especially in your extremities, like your legs and your feet and your hands. Can you just verify your name and date of birth for me? Perfect. So some things to look out for with this medication is you may have diarrhea, dry mouth, nausea, vomiting. You want to make sure that you avoid the sun. Make sure you're using sunscreen because this can make your skin more sensitive. When you're at home, make sure you take it as directed, and then always make sure that you drink enough water, okay? So go ahead and take this for me. Perfect. I document that you got it at whatever time, 8:14. Tolerated well. We also want to keep an eye on your blood pressure, and then we're also going to have you hooked up to an EKG just to make sure there's no abnormalities with your heart. And then we're also going to keep an eye on your blood levels. We're going to recheck your labs in a few, make sure you're okay with your sodium, your vitamin K, and such, okay? I'll be back shortly to check on you. The next patient is Dixie McCall, date of birth 3/6/68. She's given Lipitor for hyperlipidemia. This is 10 milligrams by mouth daily, ordered by Dr. Who. We have the medication here. Expiration date is good. And then name, atorvastatin, Lipitor, 10 milligrams, perfect. Hi, I'm Taylor. I'm going to be your nurse today. Dixie? Hi, nice to meet you. So it looks like the provider ordered some some Lipitor for the hyperlipidemia. Can you just verify your name and date of birth for me? Perfect. Just gonna take a look at your bracelet. All right. So for this medication, some common side effects is you may get a headache, you may get dizzy, some nausea, vomiting, abdominal pain. You might also develop a rash and also some chest pain. This is completely normal. We do advise you to take this as directed when you get home, and then avoid more than 1 quart of grapefruit. This can interfere with the medication. So I'm gonna make sure that you get that. Just gonna scan the medication, scan the bracelet, document we're giving it to her. She's gonna take that. And then while this goes on, we're gonna monitor her blood levels of her HDL, her LDL, her high and low cholesterol, and also the total, just to make sure that the medication is working. And then when she goes for future appointments, then she'll also have that done through her primary care. We also want to monitor her liver enzymes and her liver function before administering this medication. Make sure there's no damage, as this could further damage the medication. Amy Farrah Fowler, date of birth 10/22/1967, allergic to penicillin. She's coming in for fluid retention. Dr. Who ordered some Lasix, 20 milligrams to be taken by mouth daily. The medication we have on hand is furosemide, Lasix, 20 milligrams. Date of birth is good. Hi, my name's Taylor. I'm going to be your nurse today. Amy? Hi, Amy. So it looks like you're having some fluid retention. How are you feeling? All right. Dr. Who ordered some Lasix for you. This should help bring down the swelling and especially in your extremities, like your legs and your feet and your hands. Can you just verify your name and date of birth for me? Perfect. So some things to look out for with this medication is you may have diarrhea, dry mouth, nausea, vomiting. You want to make sure that you avoid the sun. Make sure you're using sunscreen because this can make your skin more sensitive. When you're at home, make sure you take it as directed, and then always make sure that you drink enough water, okay? So go ahead and take this for me. Perfect. I document that you got it at whatever time, 8:14. Tolerated well. We also want to keep an eye on your blood pressure, and then we're also going to have you hooked up to an EKG just to make sure there's no abnormalities with your heart. And then we're also going to keep an eye on your blood levels. We're going to recheck your labs in a few, make sure you're okay with your sodium, your vitamin K, and such. Okay, I'll be back shortly to check on you. Linda Belcher coming in for arterial fibrillation, no known allergies, date of birth 9/4/1972, Coumadin 5 milligram as taken by mouth daily for AFib, ordered by Dr. Who. Medication, we're checking warfarin, Coumadin 5 milligrams, and then also the expiration date and lot number. Hi Linda, my name's Taylor. I'm going to be your nurse today. It looks like the doctor ordered some Coumadin for you. Have you taken this before? Yeah? Okay, so you know how it works. We're going to make sure that your PT INR stays within range of what the doctor wants, which is usually between 2 and 3. We're going to make sure that we recheck your blood in a few, see what your level's at. It can take a couple of days for this to start taking effect. So just when you're at home, make sure you're taking it as directed, following up with your PT and INR test, and then follow up with your primary care as well. Can you just verify your name and date of birth for me? All right, just going to take a look at the bracelet. I'm going to scan the medication, scan the bracelet. Medication's going to be in the cup. Patient's going to take it. And then also gonna inform her not to drink any alcohol, making sure to keep a same diet, not increasing any greens, so no increasing of salad, leafy green vegetables like spinach. And then we also want to make sure that she is using a soft toothbrush, flossing, as her gums may bleed. We're also going to document what time we gave it to her, what her lab stated when she had them done prior to getting the medication, which will involve the PT, INR, CBC, and then also making sure that we're documenting the input and output of her stool and urine, as they can have an inconsistency. Stanza Stark, date of birth 2/21/1990. A patient is allergic to penicillin. Diagnosis is heart failure. She's given digoxin 0.25 by mouth daily, and then also hold for if heart rate is below 60. Dr. Who is the one that ordered it. Medication is digoxin, lanoxin, 0.25 milligrams. Date or expiration date. Hi, my name's Taylor. I'm gonna be your nurse today. Are you Stanza? Hi, Stanza. So it looks like you're having some problems with your heart. It's not pumping like it should. So we're gonna give you some digoxin, also known as lanoxin. Dr. Who ordered some to take by mouth. Can you just verify your name and date of birth for me? Perfect. I'm just gonna take a look at your bracelet. All right, and it does look like you're allergic to penicillin. Any other known allergies to medications? No? Okay, perfect. So with digoxin, we're going to keep an eye on you, on your blood pressure, your heart rate, and keep you hooked up to an EKG, just to make sure that your heart's doing what it should be and isn't getting any worse. So you can have some fatigue. It might make you a little tired, a headache, and then also can cause some weakness. So if you have any of those, just let us know so we can let the provider know, okay? And then if you're taking this when you're at home, you're going to take it as directed, reporting any nausea, vomiting, or diarrhea to your doctor. Scanning medication, scanning bracelet, administering the medication to the patient, and then also documenting what the patient is taking, that we informed her. And then we're also gonna keep an eye on your electrolytes and your vitamin K. We don't want it too low and we don't want it too high. We kind of want it right in the good middle. And if you have any questions, just let us know. And then your call light is right next to you. We're gonna raise the bedside table or side. We're gonna move the table that way, and then we're gonna leave the room. James Smollett. Date of birth is 8/10/85. Diagnosis is hypertension. No known allergies. Dr. Who is the doctor. He ordered some hydrochlorothiazide, 12.5 milligrams to take daily by mouth. Medication expiration date is good. Hydrochlorothiazide, 12.5 milligrams. Hi, my name's Taylor. I'm going to be your nurse today. Are you James? Hi, James. All right, so it looks like Dr. Who ordered some hydrochlorothiazide for you for your hypertension. Have you ever taken this before? No? All right. Okay. So we're going to make sure that your blood pressure is okay. So you're going to be hooked up to a monitor throughout this whole visit just to make sure that your blood pressure is what it should be. We want it below 140/90, which is good. Anything below that. So, gonna scan the medication, scan bracelet. Patient's gonna take medication. Going to document giving patient 12.5 milligrams. Patient tolerated. Okay. Informed patient of patient education, taking as directed. Also make sure that you use sunscreen, as this can make your skin more sensitive to sunburn and rashes. If you have any questions, just hit your call button. We'll be with you if you need anything, okay?